there are other options to look at before you think about surgery.
So what if there is an excessive bleeding or something?
It's part of fibroid symptoms for you to have excess bleeding. So mostly you have treatments like you have treatments like birth control pills, IUDs, and all those stuff. There are different treatments. You can start by dieting. If it's affecting you, if it's not affecting you, leave it.
Yeah, I get what she said. If it's not affecting you, if you don't notice anything in your body, just leave it. But unless you're feeling something, or maybe you're passing blood unnecessarily, or you're feeling pain, then you can try this treatment.
Yes. So change your diet, lose weight, exercise, then go for birth control. Talk to your doctor, try birth control first. If that doesn't work, then we look at something else. Because fibroid, what it is about fibroid needs a blood supply. Okay. So when you do birth controls, you are increasing your progesterone and decreasing your estrogen. So when estrogen is a lot in your body, that's when that's what makes fibroid kind of grow. Because estrogen is a lot, so they'll be growing out of order. But when there's progesterone in your body, it decreases the chances of them growing.
So what's the best advice to give to somebody that has
fibroid
and is scared of losing her womb? You get maybe due to surgery, maybe the doctor is telling you that if you don't do this surgery, maybe to the extent that I've gone to, you cannot be able to have a child, or there is complement, that kind of thing.
Yes. So depending on the size, and if you cannot have a child, please by all means look for other things that are wrong with you. Do not blame fibroid for it. 1. 2, if you have to try, to be honest, I'm an advocate for herbals. I try herbals first before I go to surgery, because surgery, there's always a risk of dying, 1, and the complications sometimes, like she said, you can lose your womb. But if you're going to have surgery, please do not go to any cheap. Surgery is not time for you to put price tag.
Yes, because it has to do with your womb.
It's not time, especially when you have not had your kids. It's not time to be putting price tag for it. Go and try and get a certified person. If the person is certified, you have done your research about it and know what type of surgery you are having. There are different types of surgery, and I'm sorry, but Africa, I will not trust my life with the type of surgery they are going to do. I would advise you to try and go to Abuja, try and get all these top people. It's your life. If you haven't had any children, if you have had children, you can take your risk. But if you haven't had any children, please, if you can, just fly. South Africa too is close and they are very good. So please.
But we are in Nigeria.
So I talk for the poor people.
Yes, because mostly people that have this illness, most people they don't know, and maybe they are not opportune to have the money to fund the operation itself. There are some places you go to tell you it's 30k, there's some places you go to say it's 70k, some places 150. And when they've told you 30k, you be like 150, okay, wait till you do, maybe because my brother that kind of thing. So here, somebody that cannot afford 150k, how much flight will you take to all those places? So I believe what you need to do is to find the best doctor, because you're not the only one. People actually suffer. Just talk to somebody. You don't need to keep it to yourself. Talk to somebody.
And try normal things. Try exercising. Try things that are going to relieve pain. Birth control is cheap. It's the cheapest route. Try birth control. Hopefully it works for you. Try birth control. That's cheap. That's affordable. And then try some natural herbs and remedy. Do not go to mama that lives down the street. Try people that you know it has worked for. And talk about, be open about it. You don't know, somebody might be going through it and they know where they went starts. Because Nigerian healthcare system, I understand what you're saying.
Is as long as Nigeria is concerned. Even most people, mostly what we do when you don't have money, you go to maybe FMC, Federal Medical Center, or what's the other one?
That's true. Government hospitals are actually very good in operation because of the teaching and everything. So they are actually very good. Yeah.
But that's not 100% guarantee that everything is going to go right.
This is Nigeria, just 50% guarantee. Once you can get 50, I think you should take a risk.
Yes. You see, I told you she's certified. So what you need to do is don't forget to talk to somebody, because most times what kills people are
silence.
Yeah, silence, and you get depressed and all that. Maybe your man, like he has refused to marry you because of maybe you told him about it, or you told him about this and that. Here, most guys, before they marry you, they want you to get pregnant, or they'll take you to the hospital and tell the doctor to check you out. So when they check your womb, I've seen one. Like the guy was like, see this girl, I like her. I said, the girl is fine. He said, but he's taking her to the hospital to check her up and check himself too. So when they got to the hospital, he came back to me and was like this girl get fibroid. So he never walk. There's not seriously. He told me that it's not going. The girl was looking so nice and all that. I was like, but he told me you love this girl. He said you can't take the risk.
Fibroid is not a death sentence. Fibroid does not mean you cannot get pregnant. I know somebody personally. It took her a while, but she had 5 children with fibroid, like a big fibroid. She had 5 good children. So it's not a death sentence.
So what you mean is even with fibroid you can get pregnant?
You can. It actually, do your research. You don't even have to take my word for it. Do your research. Fibroid does not hinder you from not having children.
So lovelies, if this is your first time on my YouTube channel, please don't forget to click the red subscribe button below and turn on your notification bell so you can get updates. We say lots of things, lots of interacting things like health issues, anything you come across that's going to be of use to you. And don't take it for granted, okay? As long as it has to do with your health, don't take it for granted. So lovely, hope you enjoyed the video as much as I did enjoy it. I made it with love, okay? Don't forget to subscribe to my YouTube channel. I love you.
And this is my first time visiting, so please subscribe. I know she's passionate, but if she sees more subscribers, she'll keep up putting content.
Love you.